மாதா தொலைக்காட்சி நேயர்களுக்கு என் அன்பார்ந்த வணக்கங்கள். மாதா தொலைக்காட்சி மற்றும் சென்னை கொளத்தூர் மெரிடியன் மருத்துவமனை இணைந்து வழங்கும் நலம் தரும் மருத்துவம். இன்று நம் நிகழ்ச்சிக்கு வந்திருக்கும் சிறப்பு விருந்தினர் அவர்கள் 35 ஆண்டு கால அனுபவத்தை கொண்டிருப்பவர். அவர் 16,000த்திற்கும் மேற்பட்ட இருதய அறுவை சிகிச்சைகளை செய்திருக்கிறார். அதிலும் குறிப்பாக 700 கிராம் மட்டுமே இருந்த ப்ரீடம் பேபி குறை மாதத்தில் பிறந்த குழந்தைக்கு சிறப்பாக அறுவை சிகிச்சை செய்து அக்குழந்தை இப்பொழுது 25 வயதை எட்டியுள்ளது. இத்தகைய சிறப்பான மருத்துவர் மூசா குன்ஹி அவர்களை நம் நிகழ்ச்சிக்கு அன்புடன் வரவேற்கின்றோம். வணக்கம் சார், நல்லா இருக்கீங்களா?
நல்லா.
ஓகே சார், since you have talked about pacemaker, அதோட ஸ்பெஷல் இண்டிகேஷன் ஹார்ட் ரேட் 60க்கு கீழே போகிறது மட்டும்தானா? ஓகே சார், ஹார்ட் அட்டாக்ஸ்க்கான ஏர்லி வார்னிங் சைன் என்ன? அது எப்படி நாம கண்டுபிடிக்கிறோம்?
Heart attack, it's sometimes there won't be any warning signs. Suddenly it will come, like out of blue. Suddenly it will come, person can collapse and he can go into cardiac arrest. That means heart will stop. Heart will stop pumping. Heart has to pump regularly. Regularly something like 70 to 100 times normally. And when we do exercise, walk and all, it can go up to 120, 140 like that. And if it's below 60 means it is also not good. It is a heart rate is low. So what happens is when the heart attack comes, the heart can stop. That means this pumping action will not be there. Heart will just electrical disturbance will come. What we call it as a ventricular fibrillation. So there won't be any circulation at that time. And within 2 minutes he will die. You will get only 2 minutes left. And the heart cardiac arrest, that is called cardiac arrest. So heart attack is a reason for cardiac arrest. Heart attack first வந்து oxygen கிடைக்காது, heart electrical disturbance போயிடும், or pumping power போயிடும். Pumping போயிட்டாலும் he will, but if it goes pumping, low pumping means he will get some time, at least take him to the hospital and do medications, or we have got so many other equipments like IABP, so many methods are there of treatment to save his life. He will get some time. Whereas fibrillation, electrical disturbance comes means you don't have any time. You will have a time only just less than 2 minutes. You have to give a sudden cardiac CPR. And he has to be taken to the hospital. So chance of death is very high due to the cardiac arrest. You know, heart is nothing. Heart works under one electrical system. There is an electrical system in heart. Heart works, converts the electrical energy to the mechanical energy. That is the importance of heart. So when these electrical disturbances are affected, sometimes it goes to high rate, or sometimes it will be just like fibrillate. And that means it will not be effectively contract. That is called fibrillation, cardiac arrest. Or the rate can come down below 60, like a 40. 60 is the normal. 40, and if it comes to the 40 like that, there is a reasons are there for many reasons. And one reason, electrical failure reason, we can try with the medicine. If it is not effective, then we have to put the pacemaker. That means there is a pacemaker. Nowadays it is, till now it was coming with the battery, and the wire will go from the battery to the heart, and every minute it will fire 60, and if you are kept the rate to 70, it will 70 or up to 100 we can keep it. Nowadays we get battery-less pacemakers. That means it can be sent to the heart through catheter. Surgeon is not required. Cardiologists themselves can manage. So new type of pacemakers. Now it is gone out of, surgeons are not involved in pacemaker nowadays. Like 20-30 years back, pacemaker was fixed by the surgeons, cardiac surgeons. But now we can do the pacemaker fixing without operation, without surgery, and it is done by the cardiologist. When the heart rate is below 60 or especially below 40, it will require pacemaker. It's a the battery will last for 10 years, and after that you have to replace some things of that. Yes, those are called pacemakers. Then we have to find out the reason why the heart. Suppose somebody is taking blood pressure medicines, what is called beta blocker, so many calcium blocker, channel blocker, அந்த மாதிரி மெடிசன்ஸ் எல்லாம் இருக்கும். அந்த டோஸ் அளவுக்கு if the dose of those medicines are very high, heart rate can come down. In those kind of cases, you just stop that medicine or reduce the dose. The heart rate will come back. But some conditions are there in which the electrical system is broken, like we have got a wire, like that inside the heart, we cannot see by our eyes. There are nerve fibers are there, like wires. We cannot see in our naked eyes. You need eye magnification. If suppose there is that those fibers are broken, totally broken, it can be partial or it can be complete. When it's completely broken, then the electricity will come up to here. Beyond that, it will not pass. In that situations, we have put the pacemakers. But the electrical conduction is affected by drugs, means you stop those medicines. It will slow down the speed of the electrical conduction in the inertia or in the electrical system of the heart. In those kind of cases, so we have to find out what is the reason for the low heart rate. If it is a drug related, stop those medications. Or if diabetes also can affect the electrical system. So some of them can be managed with medicines, and if it's totally broken, like a electrical wire is cut, then we have to put the pacemaker. That is the reason. So we have to, cardiologist has to find out the reason why the heart rate is so low, whether it is related to any disease or related to any drug intake, like especially BP medicines. Medications we take for the blood pressure control, that can cause this bradycardia, and some other drugs also can cause bradycardia. Or is it really due to the breaking or the fibrosis? We call it fibrosis, like that. It's not that physical break. It will be, the cells will replaced by the fibrous tissue, which will not conduct the electrical signals. Like electricity will not pass through fibrosis. So in that kind of, if it is a partial one, we can manage with the what you call medications. But if it is completely damaged, means you have to replace with the pacemaker. You have to do that with the pacemaker. In that, we can set the rate. Like if we can keep it at 60. Different type of pacemakers are there. One chamber pacemaker, two chamber pacemaker, like that. So that's all increases the efficiency and the pump, the blood, the pumping power of the heart, or how much liters blood it can pump per minute flow. It's a very big subject. But in some cases, the heart rate low means we can manage with the medicines. There are medicines to increase the heart rate, or you can stop the medicines which produces which makes his heart rate too slow. In some cases, it has to be by pacemaker. So it has to be somebody, cardiologists will diagnose by various methods of tests, investigation, and find out what is the reason for his low heart.
ரொம்ப காமனா சர்ச் ஆன பேஷண்ட்ஸ் என்னன்னா, ஹார்ட் அட்டாக் இல்ல ஹார்ட் ரிலேட்டட் இஷ்யூஸ் என் ஃபேமிலியில இருந்திருக்கு, அது எனக்கு வரதுக்கு எவ்வளவு % சான்சஸ் இருக்கும், அண்ட் அதுக்கு நான் பயப்படணுமா?
Heart attack disease family related, especially in Indians. There is a genetic predisposition. எவ்வளவு அளவுக்கு வரும் அது தெரியாது. It is difficult to say how much risk is there. But like a father, mother, brothers, anybody is having heart disease like heart attack, there is a high chance that you likely to get it. Especially if you have high stress, if you are a smoker, if your blood pressure is high, if your blood cholesterol is high, your blood sugar is high, your sleep is not adequate, you sleep very less, like 5 hours, 6 hours, like if all those things, then you have got a lot of stress. All these put together, if it is there, there is a high chances then. So that you can do the test for after the age of, say, if there is a strong family history, strong family history of diabetes, strong family history of hypertension, all these thing is there, that means you are likely to get. Be careful from the age of 25 or 30 and regularly do these tests like blood test, check your blood sugar, check your blood pressure, cholesterol, see that you are properly sleeping at least 7 to 8 hours a night per night. You should sleep, and you do regular exercise like walking, at least 1 hour walking, at least a level of 3 kilometers in 1 hour like that, and do some exercises. Con- Control your body weight. All those things very important. This is a way we can early find out from the age of, if you do regularly these things from the age of 25 like that. For children, most important is uh, playtime. Nowadays we don't give. That is it's a wrong. We should allow them to play because heart becomes stronger by doing exercise, doing play. So children should be encouraged to do the activities that prevents the heart disease.
ஓகே சார். ஹார்ட் ஆப்ரேஷன்ஸ்க்கு அப்புறம் எவ்வளோ நாள்ல ரெஸ்பெக்டிவ் அந்த அந்த பர்சன் வந்து எவ்வளோ நாள்ல வந்து they can return back to their normal life?
Usually open heart surgery means 2 days they will be in the ICU, usually, or sometimes 3 days. Then they have to be in the hospital for 1 week. After the discharge, they can take rest for 1 week, but they can walk around the house like that. After 2 weeks, they can walk outside, they can go out, but they should not drive. Driving, everything will 1.5 months. By 1.5 months to 3 months, most of the people become all right. They can go back to their work. They can do the heavy work also, weight lifting, all those things. So it takes about 6 weeks to 12 weeks. That means 1.5 months to 3 months after the open heart surgery. It takes time for the bone to heal and everything come back to reasonably good strength. So I usually advise not to drive for 1.5 months. 2 months they can do the driving. After two months they can do heavy work like lifting weight for 10 kilo, something like that. After the 3 months or 4 months, then they can do their normal activity, provided their heart pumping is good. If the heart muscle has damage, they may not be able to do their regular activity for till the heart pumping power comes back. So normally it takes about 6 weeks to 12 weeks for them to be reasonably good.
ஓகே சார். சார் ஒரு லாஸ்ட் கொஸ்டின் சார். வாஸ்குலர் ஃபீல்ட்ல அனியூரிசம் அப்படின்ற டேர்ம்னா என்ன? அது எவ்வளோ சீரியஸான ஒரு இஷ்யூ?
Aortic aneurysm. Aorta means our main artery of the body is called aorta. Aortic aneurysm is like a time bomb inside our body. It can burst anytime. Aneurysms. So aneurysms are time bombs, silent killers. Aneurysm means we have got a big artery is there, very big artery, aorta, from the heart to up to this level. It is about 2 centimeter diameter. In that, some reason, there are many reasons are there, like smoking, like then diabetes, hypertension. So many things are there. Because of this, something, in some reasons we don't know why it is happening. Maybe genetic, by birth itself there may be some weakness in the segment of the artery or aorta. So what happens is over a period of time, slowly it bulges out that particular area, or sometimes entire aorta can enlarge. So mostly it is in some segments it bulges, this keeps on bulging. Normal diameter is up to 2.5 centimeter. So if it goes more than 4 centimeter diameter, is a mild. there is a chance that there is some 5 to 10% chance of rupturing. But if it crosses more than 5 centimeter diameter, there is high chance. If it becomes 6, 7 centimeter, that the chance of rupture is very high, like 90%. Anytime it can rupture. And if it ruptures, aneurysm rupture means you won't reach the hospital. All the blood will come out of the blood vessels, and it can rupture into the chest, or it can rupture into the abdomen also. Aneurysm can occur in the abdomen or in the chest. So it can affect the life. We may not reach even hospital. We may not be able to even tell that he had some problem. That is called aneurysms. So it is like a time bomb sitting in your, inside our. So aneurysm will not occur suddenly. It occurs slowly. It takes 5 years, 10 years, 15 years to become certain level of seriousness. So it can remain inside the body without any symptoms. Suppose an aneurysm comes in the abdomen, it will not produce any symptoms initially. It will be silent. The rupture will be the first symptom itself. Or if it occurs in the chest, there may be sometimes some symptoms like back pain, the back spine pain வந்துடும், abdomen இந்த abdominal pain வந்துடலாம், chestல இருந்தா கொஞ்சம் மூச்சு விட்டு இந்த மாதிரி breathlessness எல்லாம் வந்துடும். So anyhow, aneurysm is a long, it remains in the body for long time. So frequent checkup, like suppose you take an X-ray chest, there is no aneurysm, means okay, or it will not come for another 10 years. Or you can do abdominal ultrasound, CT scan, all those things can. So it all depends on where the aneurysm occurs. If aneurysm occurs and it presses some other nearby structures, there will be symptoms. In some cases, the symptoms may be in the leg, but aneurysm may be in the abdomen. So aneurysm is one of the third important cause for sudden death. Myocardial heart attack is the number one cause, and third important cause is the aneurysm. The bulging of the is a very major subject. So we can treat it by surgery. We can treat it by non-surgical method also. We can put stent. In some cases, we can put stent. It all depends on where the aneurysm occurs, whether it occurs in the chest or in the abdomen, or sometimes between abdomen and chest. Between abdomen and chest means there is a high complication. They can go for, the legs can get paralyzed. If it is abdomen means we can treat with the surgical as well as non-surgical. The chest means we have to need operations. We have to replace that segment of the aorta with the synthetic tube, which is made up of PTFN poly Teflon material, அந்த மாதிரி material, Dacron material, tube வருது, அந்த tube விட்டு permanent ஆயிட்டு. These are all complex operations, very complex. We have to stop the heart, we have to stop the heart lung machine. ரொம்ப டைம் எடுக்கும். Sometimes it takes 10 hours. Bleeding வந்துடலாம். ரொம்ப 10 bottle, 20 bottle blood எல்லாம். So that is a little risky operation also. This all depends on where it has occurred and how it is, what stage it is. So this aneurysm is very important and it's a very big subject.
நீங்க ஒரு கார்டியோதொராசிக் வாஸ்குலர் சர்ஜனா, நம்ம மாதா தொலைக்காட்சியில நலம் தரும் மருத்துவம் வியூவர்ஸ்க்காக உங்களோட டாப் ப்ரையாரிட்டி ஹெல்த் லைஃப் ஸ்டைல் மாடிஃபிகேஷன்ஸ் பத்தி ஒரு 5 points.
Yeah, that's important. Nowadays, heart disease are increasing. The most important thing is heart disease can be prevented. We can prevent heart disease, especially heart attacks and coronary artery disease. We can. So take care of a balanced diet, very important. Take care of your weight. You should not have obesity. There is a for a age you have a normal scale of weight. You should not exceed that BMI. So your BMI should be something like a 25 to maximum 25. You should take should have at least 7 to 8 hours sleep every night. Very important. You fix your sleep, then you do your work. Not that you finish all your work and then go. No, you have 7 to 8 hours sleep. Then check your blood pressure regularly and see that it is within normal limit. If it is high, you treat it. Check your blood sugar and control it. Have a regular exercise, at least 1 hour walking at a medium speed, and reduce your stress as much as possible. Don't take unnecessary stress and other things. And these are the most 7-8 factors are there. If you take care of this if you make it as a part of your life, as a part of your life, and you actively take care of all these things, there is a good chance that you can prevent heart disease like heart attacks and blocks in the heart. And when these diseases has already occurred, means to take the proper treatment at right time. That's important. Delaying the treatment will cost your life, or it will make you more sick. So right time, right treatment, and see that you do all these 8 factors which I explained properly and make it as a part of your life. Then you can control, to certain extent, you can control the heart disease, you can prevent it. Okay, that is what I have to say to the public.
இவ்வளவு நேரம் எங்க கூட இருந்துட்டு எல்லா இன்ஃபர்மேஷன் ஷேர் பண்ணதுக்காக ரொம்ப நன்றி சார். தேங்க்யூ சார். ஓகே நண்பர்களே, டாக்டர் மூசா அவர்கள் நமக்கு ஷேர் பண்ணதை வச்சு நம்ம புரிஞ்சுக்க வேண்டியது, நமக்கும் நம்ம உடல் மேல அக்கௌண்டபிலிட்டி இருக்கு. நம்ம உடம்ப நம்ம தான் பார்த்துக்கணும், நம்ம இருதயத்தை நம்ம தான் பார்த்துக்கணும். இது போல மற்றும் ஒரு சிறப்பு மருத்துவரோடு மீண்டும் உங்களை சந்திக்கும் வரை உங்களிடமிருந்து விடைபெறுவது உங்கள் நான் டாக்டர் பெட்டினா. நன்றி, வணக்கம்.